Hey guys, Justin Brock back here at Bobby Brock Insurance, and I want to take a minute to go a little deep dive into Part B of Medicare. Part B, your medical, your outpatient coverage. So stay tuned and we're going to get right to it. Okay, Part B of Medicare is often kind of thrown out there as outpatient, but there are even some services that are covered under Part B while you're in the hospital. Because remember, Part A is more the room and board portion. So with Part B, I wanted to use a quick reference here to just annotate some things that might be covered under Part B. Provider services, durable medical equipment, home health services, ambulance services, preventative services, x-rays and lab tests, chiropractic care, and certain prescription drugs. That's right. For instance, if you are on an insulin pump, the insulin that goes in the pump would be considered part of your durable medical equipment and would be covered under Part B instead of your Part D drug plan. So it can come very, very in handy. So let's get into what Medicare Part B's parameters look like. And I hope that you think it's a lot more simple than it is over on the Medicare Part A side. Okay guys, Part B, I'm going to break it down, and again, yes, I'm going to use a quick reference just like I did with Part A. So Part B, you have a Part B deductible to meet. In 2019, when I'm making this video, that deductible is $185. That's a calendar year deductible. Once that deductible is met, you would then get into the 80-20 portion. So a lot of you have probably heard you need to get something to pay that 20%. Well, at this point on Part B, that covers all of those services we mentioned before, Medicare Part B would pay 80% of those services and you would pay 20%. One of the biggest problems with Medicare and having it as a sole coverage without any kind of supplementary coverage is that the 20% coinsurance on Part B has no catastrophic limit or no maximum out of pocket. So many people get a supplement to come in and take that burden off. So that's pretty simple because in the majority of services you're talking about $185 calendar year deductible and then 80-20 coinsurance with no limit on the 20% coinsurance. So a couple of other things you would see under Part B is Part B excess charges. So it is possible that you go to a doctor who doesn't accept Medicare assignment. It's pretty rare, but we do see certain specialties that do this. And what they do is they don't accept assignment, but they will take money from Medicare. And so they can charge in excess of what Medicare approves as the charge. So Medicare might tell them, hey, for this $100 service, we're only going to approve, or let's say $150 service, we're only going to approve it at $100, and so they would charge 15% in excess of what Medicare approved, thus charging you another $15. So that's called a Part B excess charge. Also, with Part B, you could get into clinical laboratory tests, but with Medicare Part B, those tests are covered at 100%. Again, on the durable medical equipment, it really just works exactly the same as it does with the other services I was talking about. Once your $185 deductible is met, the plan is paying 80%, you're paying 20%. Sometimes 20% of a durable medical equipment rental can add up, because typically if you get a wheelchair or if you get an oxygen tank or if you get an insulin pump, the Medicare actually leases that from a company and pays a monthly fee. And so without some sort of other coverage like a Medicare Part C plan or a Medicare supplement or Medigap plan, you could be paying 20% of that rental fee for as long as you need that durable medical equipment. Okay, so that pretty much wraps up the Medicare Part B details. Now, I hope that you could see it's a little bit easier to understand, but it's also easy to see how there could be a ton of out-of-pocket with Medicare Part B without some additional coverage. There are multiple additional coverage options in most counties and most zip codes across the country, and we'd love to help you look into those and love to help you make a decision on those. You can always call us at 662-844-3300, or you can go to our website and request information there at BobbyBrockInsurance.com. Thanks for tuning in. On the next video, we're going to get more into Part C.